Good afternoon, everyone. Good afternoon. Since COVID-19 first reached Chicago, we made a firm commitment to base our policies and initiatives on the science and the data of this disease, and to communicate these decisions to the public in an open and transparent way. This approach has driven every single one of our actions throughout this crisis, from its earliest stages right on through today, none of which have been easy, but all of which have forced us to make sacrifices, which of course is the most challenging for our most vulnerable residents. But we've done this in order to achieve our singular goal of halting the spread of this disease and saving lives. And our work has begun to pay off. We, meaning you, have not only saved the lives of thousands of Chicagoans by following the guidance from our public health departments. We must also commend the heroic work of our healthcare system and our healthcare workers. There will never be adequate words to thank them, as well as our first responders and essential workers who have been sacrificing on behalf of every resident in our city. We've begun to flatten the curve of Chicago's COVID-19 cases. However, as I said before, we must never confuse promising gains with outright success. We are not at the point where we can begin reopening our city yet. The light at the end of the tunnel is absolutely there, but it's still just a glimmer, and we still have a long way to go before we can safely return to the way things were before. We will get there, but we have to do it in a way we've always done it from the very beginning of this pandemic, to be guided by the data and the science, our public health guidance, period. To do otherwise would be reckless, irresponsible, and of course, deadly. And I will not allow that to happen in this city. That's why today, I'm proud to be joining our Public Health Commissioner, Dr. Allison Arwady, and others here to announce the Protecting Chicago framework, specifically designed for Chicago's residents and businesses, and encompassing a clear, data-driven 5-phase process. This framework was created to enhance Governor Pritzker's outline for reopening our state and tailored to our unique environment here in Chicago, and build on the governor's leadership across Illinois through this crisis. We have been working on these plans for weeks, but we agreed that the state, of course, should go first, and then we would work to harmonize our plans with those laid out by the state. Protecting Chicago framework is more than just a roadmap for city leadership. It's about protecting all of our residents and businesses, as well as protecting the future of our city as we move through this crisis and lay the foundation for the recovery that must and will follow. This also represents a framework for the dialogue we'll be having with our residents and businesses throughout our reopening process, a process of dialogue that's been ongoing throughout. The first phase of protecting Chicago follows the strict guidelines of staying at home and maintaining safe physical distance from anyone who you do not live with. Phase 2 does the same, however, while also seeing us flatten the curve of Chicago's COVID-19 cases, and we believe that we are in phase 2 now. And its rules are the ones we all know well. Only go out for essential activities, brief walks near your home, and when you go out, wear a face cover and practice safe social distancing. Following this phase, when the science and the data allows, we'll move to phase 3, which will be a limited reopening. This includes non-essential workers returning to their jobs in a phased manner, and select businesses, nonprofits, and city entities opening if they can demonstrate a plan for appropriate protections for employees and customers. This phase also allows for a limited reopening of some public amenities and small non-business social gatherings limited to 10 people or fewer. However, make no mistake, This phase still has us wearing face coverings and physically distancing when meeting others. It also has those of you who are sick continuing to stay home. And this guidance that even if you're a little bit sick, that you must stay home will continue for the foreseeable future. Those that are a member of a vulnerable population will also be advised to continue to stay home. And those you've come into contact, and if you've come into contact with someone who has COVID-19, continuing to stay home, as well as immediately contacting your healthcare provider if you have COVID-19 symptoms. Phase 4. Phase 4 sees us reopening a little further, with additional businesses coming back online, more restrictions being lifted, and additional reopening of public amenities, with all residents continuing to wear face coverings and physically distancing, and vulnerable populations continuing to shelter in place. Finally, after all the appropriate measures are met, we will reach Phase 5, our 5th star, which is a near complete reopening of our city. That means businesses are opening up, workers returning to their jobs so long as they're staying healthy, and most activities and events resuming, though possibly with some caveats. This phase will be supported with workplace screenings and tests. I want to pause for a moment to take a special note about our businesses. What I want is for our city to come out of this crisis stronger and more resilient than we've ever been. I want our recovery to stand as a model for other cities around the world. I want nothing less than for our efforts over the coming months to truly warrant a 5th star on our flag. However, we are facing an urgent crisis with scores of businesses struggling to survive, particularly our small and micro businesses, many of whom are truly hanging on by a thread. Based on the numbers we are seeing, if these businesses don't open soon, many will be forced to close their doors entirely. And so, to our businesses, I want you to know that we're doing everything we can to keep that from happening, and will continue to do so throughout every phase of this crisis. Of course, we have to be led by the data and science, and only opening additional businesses when we can do so safely. And the question of safety is one that we will need to continue to be in dialogue with a variety of businesses by type, sector, size, and that will also influence and inform our public policy. In a moment, Dr. Arwady will be offering details on the specific metrics we'll need to see in order to move from phase 2, where we are now, to the next phase of our reopening. But they really boil down to answering 4 key questions. 1, is there a decrease in the rate the disease is spreading? Critically important. We've seen progress, but not a decrease yet. Do we have testing and contact tracing available to track the disease and limit its spread? Are there enough systems, support systems in place for our vulnerable populations? And last, can our healthcare system handle a potential case surge? If the answer is no to any of these, then we simply cannot and will not move to the next phase. We will also, if necessary, take a step back if that's where the data leads us. Over the next several weeks, we'll be providing further details for businesses and public amenities related to each phase of our reopening based on the continued dialogue with each sector in our city. And to that point, as I mentioned earlier, Protecting Chicago is more than just a framework for city leadership. It's also a framework for continued dialogue. Protecting Chicago itself was created in partnership with community and industry working groups from across our city. We want this process to continue to be an important and rigorous dialogue between residents, businesses, and local organizations. One size does not fit all. As I said to the alderman earlier today, we need to hear from all of Chicago in order to develop the best ways to reopen safely and move our city forward. Toward that end, we've created an online survey to hear from residents directly on the ways you can best support our reopening. Your responses will shape our decisions on where we need to place greater emphasis and how we can make our reopening as smooth and supportive as possible. And I encourage Chicagoans to fill out this survey by visiting our city's COVID website, chicago.gov/coronavirus. The survey is simple, it is short, and it is anonymous. These next steps will be important and encouraging, but we can't get ahead of ourselves. This is a framework we'll need to operate in until we have a vaccine for COVID-19. And regardless of what you may be hearing elsewhere, the truth is we do not know right now when a vaccine will be available. All of us, of course, want it to come as soon as possible. But at this point, we don't anticipate having one until sometime in 2021. And I'm going to say that again, we don't know when it's coming. We hope it's sometime in 2021, but it's not here yet. Until then, the structure of our lives will continue to be based on how we can safely move around. How do we maintain social distance, even as we gradually open up and come back together? How do we take care of and safeguard our most vulnerable residents? Critical questions for us to be able to answer. All that means is continuing our rules related to face coverings, hand washing and sanitizing, and physical distancing. I take very seriously my responsibility to keep our residents safe every day in any way that I can. And I want to thank the residents for everything that you've done to stay home and to save lives. It's been critically important. It's made all the difference in the progress that we've made in the city, but we have to maintain that vigilance and diligence in making sure that we are continuing to follow the public health guidelines. I also want to thank the countless individuals and organizations who've really stepped up in remarkable ways for helping their fellow Chicagoans in this time of great need everywhere. As hard as it's been, we are getting through this, but we must continue to work hard and be diligent. This is truly an experience like none we've ever seen before, and we have to do it together as one city in a recovery that will make all of us stronger and more resilient and more inclusive than we've ever been. And at this point, I'd like to invite Dr. Arwady to the podium to provide details on the health metrics that will be guiding our progress forward.